Despite national guidelines, 1 in 3 adults over the age of 50 does not go and get screened for colon cancer as recommended. The fact is that with a proper screening, colon cancer is very preventable. But the lack of screenings means the disease remains the second leading cause of cancer-related death in this country, and death rates could continue to climb. The good news is there's a new option available here in Jacksonville to change how doctors screen for colon cancer. It's called Cologuard, and it's the first and only FDA-approved non-invasive screening test for this disease. Dr. Kyle Edskorn is a physician with the city's Borland-Groover clinic. He's now prescribing Cologuard, and he joins us to tell us how it works. Doctor, so good to see you.
Good morning. Cologuard, well, this is the newest option for diagnosing patients who are at risk for colon cancer. Specifically, it's a genetic test. Mm-hmm. It's a genetic test using a specimen, a fecal specimen. And the neat thing is you basically have the test ordered by your physician. The kit is sent to your house. In the privacy of your bathroom, you get a specimen and you send it off in the mail, and the results come back to both you and your physician. And what it's looking for is specific genetic markers for polyps. And polyps are the structural changes of the colon which can evolve into colon cancer. Not always, but if you have a polyp, you want to have it resected. And so those patients who have a positive Cologuard test will then eventually end up having a colonoscopy.
I see. So if the first test comes back with red flags, you do have to go in and have this procedure done. And that's the big hurdle, isn't it? People don't want to go and do that.
Yeah, and this is the important thing, because there is a segment of the population which just does not want to have a prep. They don't want to be put under with anesthesia. They just frankly have fears of invasive procedures.
Yeah.
And so Cologuard, we hope, will get to those patients who otherwise would not get any kind of testing.
Now, how effective is it in the same way that maybe a mammogram is effective at diagnosing a potential issue? How effective is Cologuard?
So the literature on Cologuard, when you compare it to colonoscopy in detecting medium to large polyps, they're almost equal. The difference are for very small polyps, in which Cologuard will not be as sensitive as colonoscopy. But if you don't have anything versus colonoscopy, I mean, Cologuard now answers a option to a patient population which otherwise was refusing any form of screening.
And as we mentioned, everyone over the age of 50 in this country is recommended to have a screening done, but about 30% of American adults blow it off, and they just don't do it.
That's correct. Now, one thing I do want to stress, though, African Americans, we recommend colorectal screening to start at the age of 45, and a lot of physicians forget that.
And that is due to?
Increased prevalence of colon cancer.
Just an increased prevalence. You know, some years ago, when Katie Couric was still anchoring the Today Show, and her husband, Jay Monahan, died of colon cancer because it wasn't diagnosed until much too late. She became the national face of this early detection and screening movement. I remember so well when she underwent a colonoscopy live on television and really brought awareness. That's been 10, 15 years ago.
And let me tell you something. What she did was tremendous, because nationally, after that broadcast where she had her colonoscopy, the public awareness of colon cancer increased dramatically, and the number of colonoscopies that were being performed increased dramatically after her bringing the topic to the national forum.
Right. But now, as the excitement about that has faded, you've got to continually remind folks. And so with Cologuard now available, what is the easiest way for people in this area to access this test, which is so much easier to do?
Well, actually, and that's the neat thing about this. You don't need a gastroenterologist to order it. You can just ask your family practitioner, your primary care physician, your gynecologist. They can order this test. It's basically like ordering a blood test.
Mm-hmm. So if you're over 50 and you haven't had this procedure done, check out Cologuard, as Dr. Etzkorn says. Get it through your primary care doctor or whichever physician you see. This is a new way to screen for colon cancer. It's the second leading cause of cancer deaths in this country, but with early screening, you can really be effective in catching this disease. Such important medical news. Dr. Kyle Etzkorn with us. He is with Jacksonville's Borland-Groover Clinic, and we thank you so much for being here.
Thank you very much.
And more to come.